We present to you a technique for in-office shoulder arthroscopy for the use of diagnostic purposes. The patient is placed in a seated position, and after both sterile prep and local anesthetic administration, the arthroscope is introduced into the shoulder from a standard posterior portal. Some patients prefer to watch the procedure while it is being performed. This can serve as a great education tool to explain to the patient and the patient's family the condition the patient is suffering from and demonstrate exactly where the pathology is. Once the needle camera is entered into the joint, it is insufflated with normal saline. With the joint insufflated, a diagnostic arthroscopy can be performed. First, we look at the rotator cable and insertion of the supraspinatus tendon. We can change the arm's position into different directions to allow better visualization of certain structures. As we visualize the superior aspect of the glenoid, it is clear the patient has had a previous biceps tenotomy, given the absence of the biceps tendon. The anterior aspect of the supraspinatus demonstrates partial tearing of its insertion site, as visualized here. The partial tearing of the rotator cuff on the articular side, seen here, is easily seen with the arthroscope, but can be challenging to identify and differentiate on MRI. The superior labrum can be visualized as well as we start progressing through the glenohumeral joint. We also can see the subscapularis tendon in the bottom portion of the screen. As we go around the clock face of the glenoid, we are able to circumferentially view the glenoid labrum and inferior aspects of the humeral head. Further inspection and visualization of the supraspinatus footprint, as well as the anterior aspect and posterior aspects of the infraspinatus, can be performed. Upon completion of the patient's diagnostic arthroscopy, the normal saline that was utilized to insufflate the shoulder is removed. A band-aid is then placed over the portal site. The findings are then reviewed with the patient. The patient may resume activities as tolerated the same day of the procedure.